Welcome to the PowerUp podcast. I'm Dr. Tiv.
And I'm Dr. Krish.
And we're going to be watching a video today and giving our commentary on it. So let's watch that video first.
If the missing space is large and the patient refuses to have a porcelain crown or implant restoration, and you're concerned about fractures with an all-ceramic crown, then this is the ideal time to use a partial titanium bar combined with an all-ceramic crown. It perfectly solves both your concerns and the patient's.
All right, let's talk about this. There's a lot to unpack here.
It's a cool concept.
It's a very cool concept. So let's break down the concept. The concept is someone needs a cantilever posterior tooth rather than putting an implant in or a conventional cantilever.
They can't get an implant in there.
Yep, they are putting a titanium substrate, and then they're putting the porcelain
bridge
on top. Now, why are they doing that? What are they solving that a traditional PFM couldn't do?
That's a good point.
Yeah. It seems like it's complicating matters a little bit because PFM would have a metal substructure with porcelain on top. You could also do that with zirconia too if you wanted a stronger zirconia material.
Is titanium stronger? Is that why they're doing it?
I guess, a PFM, you could use titanium as the base already.
It's true, yes.
So, porcelain fused to metal of some sort.
Distal cantilevers are never good.
Well, let's talk about the actual dentistry part of it. What happens with the distal cantilever?
It just will lift.
It'll
because there's more forces towards the back as you go closer to the hinge joint.
That's right. So we know that in dentistry, compression forces are always going to be better than tensile forces. When you have a cantilever, you're flexing that back arm, so you've got more tensile forces, which is why I think they want a metal substructure. But cleaning it's going to be pretty hard back there.
Yeah.
They're going to have to, be able to get floss in back underneath and floss it out. And if decay happens on the distal of that 6, then that's going to ruin that whole concept. What I'm interested about is why they didn't cover the entire tooth with metal. Why is it just the lingual sides?
Yeah.
Is it so that they could get bonding with the porcelain?
Yeah.
But then if that's the case,
it won't be under rubber dam.
It won't be under rubber dam.
So it won't be true bonding.
So it won't be true bonding. So you may as well do porcelain. So I'm a bit confused about that. Yeah, a bit stumped about that.
So will it work?
Will it work?
Would you do it in your own mouth?
I wouldn't do it in my own mouth.
Okay.
So that's number one. For a few reasons. One is I wouldn't be able to clean any of those teeth very well.
Yes.
And we know that cleanliness is probably the most important part of the whole process.
100%.
2, if I want to get a tooth back there, I'd probably put an implant in rather than a bridge. And 3, it's an untested theory. It's not done all that much. So am I going to spend all that time cutting away all that tooth just to have it fail again if it lifts? And 4, the way that the pressure can be applied on the tooth, we can get lifting or changes in angulations of the teeth with orthodontic forces. So not on my mouth, but it's a very innovative concept. What are your thoughts?
Yeah, same. I don't think I'd have it in my own mouth. Looking at it, you go, wow, that's really cool.
Yeah.
But then when you break it down, you go, oh, there's a lot going against it.
That's right.
You don't want to be doing that, and then you go, it works all well, and then you get that call 6 months later, and they're like, it's come off. Yeah. And your heart sinks.
Yeah. Well, look, when the lab does a PFM, they can clean the cement between the metal and the porcelain interface. When you're cementing that in the mouth, you have to clean all that cement off.
Yeah, between the tooth and the...
between the tooth and the metal and the metal and the porcelain.
That's right.
And so it's going to be much harder to do as well. So I think, looks really cool, but probably more work than required.
Yeah.
Wow, that's a super simple podcast. You didn't even call it a podcast.
Yeah.
I don't know if you call it real or not. Well, anyway, that was the PowerUp podcast. I'm Dr. Tiv.
I'm Dr. Krish.
And we'll see you next time. Over and out.